Xerostomia, or dry mouth, is like housing a desert in your mouth. It comes from the Greek words xeros, meaning dry, and stoma, meaning mouth. So literally a dry mouth. People with xerostomia experience this parched feeling because their salivary glands are not producing enough saliva. While it can be uncomfortable, xerostomia is a symptom of another condition and not a disease itself. Let us explore why the mouth might feel like a desert and what can be done to bring back the moisture. Now, one of my patients had been complaining of dry mouth for 1 year, with difficulties speaking and swallowing. A general physical and extraoral examination found no abnormalities. However, an intraoral examination revealed dryness in the lips, floor of the mouth, and buccal mucosa. The dryness was so severe that the mouth mirror stuck to the buccal mucosa, indicating reduced salivation. Additionally, the tongue appeared dry, pebbly, and cracked. Her medical history revealed she had diabetes mellitus for 5 years and was on medication for the same. This was a clear case of xerostomia. Let us now discuss the various causes of xerostomia. Depending on their nature, they can be classified as systemic and local. Systemic causes include endocrine conditions such as autoimmune thyroid diseases and diabetes mellitus, which was the cause of xerostomia in my patient. Autoimmune disorders like Sjogren's syndrome, rheumatoid arthritis, and systemic lupus erythematosus. Infectious conditions like hepatitis C virus, granulomatous disorders such as tuberculosis and sarcoidosis, and salivary gland problems like partial absence of salivary glands called aplasia, or diseases like sialolithiasis and sialadenitis.
Pop quiz.
Moving on to the local factors. These include medications such as anticholinergics, sympathomimetics, tricyclic antidepressants, and antihistamines. Radiotherapy, treatment for head and neck cancers, and lifestyle habits such as excessive consumption of alcohol, tobacco, caffeine, and stress and anxiety. Moving on to the clinical features of xerostomia. Besides the symptoms my patient experienced, xerostomia can cause other clinical features such as burning mouth sensation, tongue fissuring, tongue papillae atrophy, rampant dental caries, difficulty with wearing dentures and oral appliances, difficulty in chewing, tasting, and swallowing, fungal infections like candidiasis and angular cheilitis. How to manage xerostomia? There are 5 main approaches to managing xerostomia. These are preventive therapy, symptomatic therapy, local or topical salivary stimulation, systemic salivary stimulation, and treating of underlying systemic disorders. Preventive therapy focuses on preventing complications like tooth decay. This is done by these methods. Use of topical fluoride, which is crucial to control cavities. The dentist determines the best dosage, method, and frequency based on the patient's specific needs. There are different fluoride therapies available, from low concentration fluoride rinses to more potent, highly concentrated prescription fluorides like 1.1% sodium fluoride. Patients must maintain meticulous oral hygiene. Frequent dental visits every 3 to 4 months help maintain optimum oral health. A dentist or nutritionist can advise on a diet that minimizes cariogenic, acidic, and dehydrating foods and drinks. Reduce alcohol and caffeine intake as they can worsen dry mouth. If fungal infections occur, antifungal medications are used to treat them. The next category of symptomatic treatment focuses on relieving the uncomfortable symptoms of dry mouth. Here are some methods commonly used. Sipping water throughout the day to keep the mouth moist. The use of water during meals helps with chewing and forming a bolus for easier swallowing. Products designed specifically for dry mouths, such as oral rinses, mouthwashes, and gels, can help soothe and lubricate the mouth. Moisturizers and lubricants containing aloe vera or vitamin E can provide comfort and relieve dryness. Using salivary substitutes in the form of an aerosol or a liquid mimic saliva's lubricating and moistening effects. Moving on to local or topical stimulation. This includes chewing sugar-free gum or candies stimulates salivary flow. Neuroelectrostimulating devices like TENS unit use electrical stimulation to activate residual functioning salivary gland tissue. While research is ongoing, acupuncture with needles inserted in the perioral region has been proposed as a treatment for salivary gland dysfunction and dry mouth. The next category of systemic stimulation involves medications called systemic secretagogues that stimulate saliva production. Two medications, pilocarpine HCl and cevimeline HCl, are approved by the FDA to treat xerostomia. Typically, pilocarpine is prescribed at 5 to 7.5 milligrams 3 or 4 times a day. Cevimeline is usually prescribed at 30 milligrams 3 times a day. While these medications can help manage symptoms, it's crucial to address the underlying cause of xerostomia whenever possible. Pilocarpine can cause some side effects. These include vomiting, sweating, headache, increased urinary frequency, wheezing, watery eyes, nausea, and gastrointestinal intolerance. Cevimeline also has potential side effects like excessive sweating, rhinitis, diarrhea, nausea, and visual disturbances, especially at night. In my patient, the underlying cause, that is diabetes mellitus, was being managed. For the xerostomia, I advised her to sip on water frequently, reduce her intake of sugary food, maintain proper dental hygiene, and use salivary substitute spray. Now that we are enlightened about xerostomia, we leave you with a table that summarizes its management. Feel free to take a screenshot. We have now come to the end of this video. Hope you had fun learning with us.